Hello everyone, I'm TV, the producer of the Optimove Podcast. In today's episode, I have a conversation with Dr. Jeffrey Guild and ask him personal questions about taking care of our aging parents. My own parents are over 80, so his insights are incredibly useful as well for me. We also break off into tangents on dizziness and vertigo and concerns around taking care of the seniors in our society. You're not going to want to miss this episode. I enjoyed recording it and feel much more informed. Let's get into the conversation now.
Why the mobile service? It's about access to healthcare. Why not just go to them? Why not make it easy and simple and streamlined to go to them in a way that's built for them, communicate it in a way that they best communicate, that's well thought out and tested and practiced for them to empower them to make a better decision about their health on a regular basis.
So it seems like you're essentially solving a really obvious problem.
It's simple, right?
Right.
It's absolute simplicity. Go to them. It came from when I was working in skilled nursing, and myself as a physical therapist was responsible for discharging someone home or being a part of a team that was discharging someone home. And people would have access to a lot of different things. But one thing they absolutely did not have access to was quality physical therapy brought to their home. And even if they were appropriate for outpatient, the best outpatient neurological, rehab at the big hospital system, how are they going to get there? There was always a challenge. How are they going to get there? The biggest problem in healthcare is access to quality healthcare. Not can we cover it by insurance and all this other stuff. It's the fact that we have not figured out the best ways enough in healthcare to provide the service to people in a way that fits their life, their lifestyle, going to them the way they are. How do you empower an 85-year-old to be able to go to all their doctor's appointments, to go to rehab 2 to 3 times a week in a large hospital system where they have to walk thousands and thousands of feet, literally, and manage and navigate a very complicated, old, oftentimes building that has been revamped however many thousands of times, and new systems being built on top of old, and now they have to manage a kiosk instead of handling a person in a parking booth, and all these changes all the time, right? And then having the time, the energy, and the help sometimes if necessary, the ability to have someone to help drive you there if needed, or you driving yourself. There's a lot of difficulty and complexity when you look at older people or people with certain medical diagnoses or certain cognitive impairments. So the memory may not be what it used to be. The speed of problem solving may not be what it used to be. And a lot of our clients, they may be absolutely brilliant, and many of them are, and a lot of them operate at a very high level. And of course, one of their frustrations is things may not be quite as quick as it used to be as far as their ability to problem solve and to process and everything else. It's not an intelligence problem. It's a speed problem, right? And so then managing an entire hospital system as part of your daily life on a regular basis, not to mention the energy and everything else. Managing how are you going to get there? Would they get the type of care that they need when they got to the large hospital system, or would they get kicked out and discharged by Medicare or whatever insurance company that dictates that, you're not going to be able to achieve as much, quote unquote, functional progress is the term that's used. So because there's not enough fast progress, we're going to have to just discharge you after, 5 or 6 visits. When you might have an 85-year-old person who wants to get back to doing things in their life that they haven't done in a long time, but they are motivated. They know they can. They want to be able to go for walks with their grandchildren. They want to be able to dance at weddings. They want to be able to get out on the boat and go fishing again. And why not? And why not provide that level of service to them on their terms in a way that they call the shots? And when I was working in skilled nursing, such a thing did not exist. And it didn't matter what type of resources the person had. it didn't matter how wealthy they were, and it just didn't exist. And so, of course, what we find is build the service and build that for people. And it's amazing the number of people we're able to help, no matter the resources that they have.
It's encouraging. As my parents are aging, I'm becoming aware of just how, I guess as a society, we're not doing a good enough job to care for them.
Right.
It's heartbreaking. My parents are starting to get to that, I guess, the ages where they kind of do need your help now, especially my father. My mother's okay right now, but it's heartbreaking that as a society, we're not doing a better job.
Right.
But clearly it's something that is a big issue that we need to address. So knowing that you exist is encouraging. Knowing that someone like you exists means that there's also somebody else. There's probably a handful of others that are trying to fill that gap.
That's been the positive thing recently. In recent years, you see a lot of changes in healthcare. You see, of course, concierge doctors. You see direct pay doctors. You see different models coming up. Whereas, 5-10 years ago, there was nothing. You had to just accept this declining quality in healthcare that was rampant. And it's also about powering families as well. So, how do we empower the children of older people to be able to be more engaged in the care of their parents? Is part of the barrier to the fact that there's just endless frustration, and everywhere that the children who are in their 40s, 50s, 60s, sometimes even 70s, they're hitting walls everywhere they turn in healthcare when it comes to trying to take care of their parents. And we see that as well. And what we see is when the kids find the right service for their parents, it's this sense of calm, this breath of fresh air. Something like this exists. Why didn't I find this a long time ago? And this makes all the difference in the world.
I think it's a tough, like I said, with my father, he had a stroke. So it's a tough thing to manage and navigate as a family. What makes it, and I think what I'm really, this is becoming therapy from your conversations, by the way. It's giving me some sense of peace, and giving me some action points as to how I should be more patient with my own family, with my parents, with my siblings. But one thing that I think you just made me realize is services like yours, like Optimove, and you being able to come to them is necessary for us to be able to show up in a way, because if we have to navigate that, because as their kids, we will be called upon, or we are called upon.
You are called upon.
We're called upon to go. Yeah, I was just telling you this before we started the video. Going to, on my own, I hate going, but when I have to go with my parents, it's even worse, because it's the amount of mazes we have to go through. Even for me, I struggle with the damn kiosk and the parking thing. It doesn't always work. And I am of conscious mind and awareness. I know this technology. But having someone, knowing that you could show up there at their home would be incredibly beneficial and make it less dramatic. It would be more inviting, right? Knowing that, like, I just show up with dad and help him out and just be a supportive person there, or translate. For me, I'm a translator a lot of times,
right?
As the caregivers or the people that may be financially assisting, your service can even help in that regard,
right? And it's also about empowering families to help their parents make decisions as well, because oftentimes their parents want their children to be involved. They know that they should have other people involved. They've seen the horror stories. They're reading relentlessly, right? I mean, our older generation reads constantly, and so they're reading all the horror stories about older people being taken advantage of. We see it as a service all the time. We've seen attempts on our clients all the time, and we're in that world, right. And we see the barriers that are put up as a result, which can be good, but also limit access to the right type of service, and that's all right, and that's a challenge with it. But it's about empowering families to be able to take on the right roles. If it helps, I think one thing to recognize is, some children can be doing one thing while others can be doing something else. So you can have that day-to-day person who's managing more the healthcare providers and the parents, and that, they might have a certain temperament to help with that. You might have another sibling who's more the researcher, who's looking for all those different types of services. They're the ones who are Googling and checking reviews and trying to find the right services and making appointments. Yep, okay, I lined dad up with this service, with this doctor to try this one out. Okay, so then you might have one sibling go with the parent to the appointment that was made by another sibling, and then another sibling is managing the finances. And so you can have all these different types of roles. And on top of that, you might have all of that going on, and you still need to bring on people who can help you manage the healthcare system better, because there's other services that provide that sort of thing as well. Yeah. So there's people that specialize in empowering families to basically manage the healthcare system because it's become so complex. Or if the children live far away and they're not around in town on a regular basis, and mom and dad want to stay living in their house, it's great, and everybody for the most part wants that for them. So how do we empower that? I think a good thing that's happening right now is people are not accepting age as it once was, right? I think you're going to see that even more with the baby boomers coming up. It's a lot more of, I'm not going to just accept this. Mm-hmm. It's happening, yeah. It's already happened. So we're seeing those changes. Yeah. It's not, this just comes with age. We hear that plenty, and that's a barrier. But also, we're hearing a lot more of, I want to continue to do a lot of the things that I used to, and why shouldn't I be able to? And why not? Why not shoot for it?
Right. And you're able to do that if you're getting the therapy. I think the challenge is doing the work.
Doing the work, yeah.
Like if they're, I can't help but kind of keep bouncing back and forth between these two topics, but if they have to go navigate that 2 or 3 times a week at the hospital versus having someone come there to their home, then they're actually more likely to follow through and actually get it done consistently. Well, you're going to show up actually. So there's that. Mm-hmm. Go ahead. I'm sorry.
Oh, we literally have clients who will work with us after it wasn't even maybe even in a large hospital system. It was just a standalone outpatient clinic, but it was the fact that they had to go and get there. It was an event every single time because the amount of energy it took, the amount of time it took. And if we think about how long it might take for you and I to get there, how long would it take for someone with a neurological diagnosis, someone who's having to utilize a walker or doesn't have the energy that they did 5 or 10 years ago? How can they manage that? So can we cut a lot of that out and just get to them in the comfort and safety of their own home? And here's the part that clinicians can grasp even more. It's the home is the best place to do the rehab because that's their home environment. So a lot of what we do so let's say neurological specialists or in inpatient rehab or in skilled nursing is how do we get them home safely? The vast majority of the work is how do we get them to get into their home, to be able to move in their home, how to get them to the toilet, and then to be able to stand up again and be able to get back to the bed or back to the chair. How are they going to take a shower? How are they going to manage the carpet?
Yeah. The basic functions of their home, navigating their own home.
Right. The steps. Yeah, I just gave advice to a client today, which was the second time we'd seen them. We treated them for positional vertigo, and vertigo is gone. Great. Now let's talk about the balance and fall component of this and all the other things that are going on. And okay, let's look at about 8 steps you have getting into your house. Let's talk about a railing. Yeah. And the difference that can make in your life. And by the way, all of your friends, when they see that railing, they will think, oh, thank God. But they will not tell that to you. And nor will you say that to them, nor would I in any point of what I perceive as weakness, right?
Right.
We're not going to tell that even to our friends, we're not going to say that.
I would have to literally get behind my dad and shove him up the 4 steps.
Right.
Try to keep him up and upright. And he's like, I got this. No, you don't. But I got you back here. Just keep going. But if I'm not there or one of the siblings, it's my mom. And yeah, that ramp, when we actually had one before, it was a nightmare. It was too steep. He had a new one installed, and it basically starts from like here all the way there. So it's a slow incline. And that ramp it was incredibly useful. So your point about just trying to get them inside the house, like I think he fell a couple of times. And I'm sure, given your experience, you hear that all the time. Just to get up to the stinking door is so frustrating. It made me so sad, but what do you do?
I've seen people discharged out of the hospital. This will blow your mind.
I know where this is going.
They had to be helped by large men into the car out of the hospital after a leg fracture, but that did not require surgery. That just needed to be healed. And they were not given any sort of assistance or thought to how are they going to get back into their house or back into the car once they leave the hospital.
Was that their concern, I suppose? Right?
And then another client, pubic fracture, again, doesn't require surgery. It's painful and there's a lot of problems with it. And this is someone with a lot of resources, right? Okay. It required the fire department to lift her into her bed after getting discharged out of the hospital. So they had to call the fire department to bring her up and lift her into her bed after she got discharged out of the hospital after a pubic fracture at 85 years old. So people are being discharged out of the hospital that way, right? So how do we, again, access to quality healthcare? It's an access problem. Or these types of mistakes are being made. How do we fill the gap?
How do we address that?
How do we then get the person into the home as quickly as possible? Because it's going to take home health a while to get to that person. How can we get there quickly? And to be able to begin to address that sort of a situation, because those situations happen every day, and it does not matter who the person is. Because I see wealth or no wealth, it happens, and I've seen both.
I think people my age, 40-somethings, whose parents are 70, 80, 90, approaching that side of their age, that spectrum of age, giving us an understanding. Because one thing I have felt is nothing but frustration for my father. Like, why don't you do the work? It's for in your best interest. I don't get it. And through our conversations, I've started to be less of a jerk about it. And actually even be much more, and I thought I was an empathetic individual, but when it comes to my father, and I'm wondering how common this is, he is the person I'm probably the least patient with, because we have our family history. We have, stuff. But you're helping me become aware of the fact that you don't know a lot of things. I don't know a lot of what's going on, and I've misunderstood his motivation, and we haven't addressed it properly. The system the people that were given to him to help him through insurance, through, I don't know, his Medicaid, Medicare, I always get confused. They were very definitely doing the check the box kind of stuff. And not necessarily working with him in the way that you're describing.
And older people don't deal well with the concept of check the box healthcare system. They grew up in an era of where the doctor came to you. The doctor made house calls, right? There was a genuine relationship between the doctor and their patients. It was a lifelong relationship where you worked with their children and grandchildren and, our family doctor. So the focus is, how do we work on bringing that back and getting away from at least the requirement? There's a time and a place for it. The the check the box healthcare system, or we have to have this test and this test and this test to validate everything. And there can be a time and a place for that. But when there's no other option other than that, we've completely gone in the wrong direction, and we're not providing enough alternative solutions. And that's really all we're doing. It's not to say that the big hospital system is horrendous. There's a time and a place for the big hospital system. There's a time and a place for everything. But when it's the only option, that's when it's a problem. It's about having enough other healthcare providers or business owners or creative people coming up with different services, different offerings, different models of healthcare to provide for a population that's getting older, that's again used to a doctor making house calls, that doesn't like the idea of the tradition of what we perceive as the traditional checkbox healthcare system. And all they want is the healthcare provider to have that relationship with them, to see them one-on-one, to spend the time with them, to talk with them, and to really get to know about their problem and to meet them where they are, not having to do this just because the third party payer says so, or because the hospital system says so, or because the healthcare company said so, or because the physical therapy employer says so, it has to be this way. We're going to meet you where you're at and empower your family at the same time. We're going to work on for lack of a better term, educating the family on what's going on. How do we empower the family to know about how do we work with our parents? And like everything, spouses, children, parents, it doesn't matter. We're all in that situation with our families, and nobody is immune from that. What we're able to provide is having the right specialists with the right temperaments to work with people that are older, with neurological disorders, with certain diagnoses, with medical complexity, and that work with people like that so regularly, day to day, almost every session, day in, day out, having complex family situations every day in, day out, that's just our world. And so we're able to empower the families to navigate everything going on so that there can be a better understanding of where the parent is coming from. So you might have a healthcare provider who's in their 20s, 30s, and 40s who completely understands the 95-year-old and their mentality and the generation that they came from, their view on healthcare, their view on life, because they work with people of that age group every single day. All the time.
Stories.
You see the similar stories all the time, and that's what we do. So then we're able to help both the older generation and the younger generation as a family navigate all that's going on. And so that way there can be better relationships, better understanding, and empowering families to make better decisions. Yeah. And it can become complex.
All of that, thank you, will also help the children be more compassionate. The sibling or the couple of siblings in the family that are a little bit more of the aggressive type, maybe be more compassionate.
Right. Or just do you figure out roles better? Is it as simple as that? Do we just say, look, we need help with certain things, and not every sibling or child is cut out to be a nurturing, caring, or not all of them are the researcher, or not all of them are a financial type person or a legal person. And so you have different children with different skill sets and different temperaments. Utilize people's strengths. And
it's like a little company.
Everybody
gets aligned to their departments based on their strengths and preferences.
It can become that.
Yeah, that's essentially what it has to be. Or otherwise, there's going to be a lot of animosity.
Right. Because everybody needs to be in a role.
Yeah.
And so put people in a position of empowerment based on their strengths. Not everybody has to be compassionate. Not everybody has to, have equal time with mom and dad on the ground, because so much more needs to be done outside of on the ground.
I think what you're also making me think is, if you have someone like yourself in your company, your provider, helping the parent actually improve, if someone is actually helping him or her take care of their health and improve, then the children can feel less stress.
Yeah.
Because I think one of the inevitabilities is you're doing all this work. We're all kind of scrambling to hopefully give dad or mom a better life, live a better day to day. But there's no improvement. And then we're like scratching our head or beating each other up. Like, why are we even bothering?
Yeah.
Right.
If you've heard of the sandwich generation, right? You have people in their 30s, 40s, 50s, 60s who are taking care of their parents and their children at the same time. They're working on getting their own kids off to college while managing their parent who's now ended up in the hospital. Now what do we do? And they're brilliant people, and they're professionals, and they do amazing things. But this is a world that they may not know or understand. And when they do, that's rare if they work in this somehow. And even then it can be a challenge because it's personal now, right? But all of a sudden you have someone who's being thrown into a situation that they may not be quite ready for or know how to navigate. So it's about putting a team around them to empower them to be able to make the right decision, bringing in other healthcare providers that are different outside of rehab.
And one thing that I really am finding that's uplifting is that there is a response. There are providers like yourself. You mentioned concierge doctors as well, concierge practices. It's and I have been waiting for this to happen. It's taken years, but people like yourself, people like the concierge, like we just mentioned, that are out there I'm doing this for myself,
right?
But that there are these providers that we can actually plug into. Yeah, it's an added cost here or there, but now you know that you can find people that will, like you're doing. You show up at the door, and you have that tender, loving care. You have the bedside manner. You have the time. That there is now more and more of that happening.
Yep.
Who only businesses that only take cash, but they also will give you the time that you need. I have a doctor that I can text.
Yep.
Dr. Stacy Benson. My daughters are on the same plan, and they have female issues. I'm so happy to know that we can text. We can message, and we'll get a response within a few hours, if not almost right away. Middle of the night sometimes. It makes me happy to know that this is possible. And what I'm hearing you say is that there are others like that, like yourself, that can help in basically assembling a team. The Avengers of healthcare to help your parents,
right?
Help our parents, right?
Right. It's just about finding the right specialist, and there's how many trips to the urgent care or the ER can be prevented by having just the right access to the right healthcare provider. A different model can make all the difference in the world, and it can make so much more sense from every angle. And again, all we're doing is providing different options for people based on what their needs are. And that's really all that matters. What we're also able to do is get to people usually very, very, very quickly compared to, it can take quite a while to get the order for home health or to get the order for outpatient. Gotcha. And then how do you schedule to get into outpatient, and you're waiting, several weeks for someone to even call, or you're having to call and follow up. Getting through to somebody in healthcare has become a big problem. In a hospital system, it's become even worse. We see doctors leaving hospital systems now and going out on their own simply because they get tired of patients not being able to get through to their office because they have to get channeled through the big hospital system phone tree in order to get through, and they can't get through. We've gotten too big.
I said this early on.
It's gotten too big. And again, and that's fine. If you need heart surgery, A big hospital system's a great place to be. If you need intensive inpatient rehab and you need a multiple specialized rehab team, then a big hospital system's a place to do it. But if you want to basically remain in your house and have the right medical team, the right rehab team, the correct healthcare management, there's a whole bunch of services now and in new, fresh models that allow you to be active and independent in your home. I get a common question I'll often get is, which skilled nursing facility should I send to my parent to, or what skilled nursing facility would you recommend, or what assisted living facility would you recommend? And of course, I've worked in a lot of different facilities, and of course, my response is none of them. And I think that's been every person's response who does get that question. I haven't yet heard of someone give a specific place to go. And the reason for that is because it's all under the same system. You can put as many flowers and, happy hours and all sorts of things. And don't get me wrong, there's some nice places and some places better than others. And there's some new models now, and there's some innovative ways to approach, the way that older people, live in certain situations. And that's good as well. But when I get the question of what assisted living facility or a nursing home or whatever should I send my parent to me, the question is, okay, can they remain active and independent in their home? Is it realistic? It's not always. And then you can really dig down and figure out the right fit as far as a facility. But especially with the pandemic, a lot of people saw what happened with facilities during the pandemic, where you have older people being completely locked in, you have families being locked out, you have people that are on hospice, on their deathbed literally, and their loved ones can't get to them.
It's heartbreaking.
That's the type of power that government and healthcare, and when things get this big and institutionalized, that type of power becomes very personal when you can't visit somebody on their deathbed. And that's the world we live in, because we saw that all the time during the pandemic. During the pandemic, we were able to get to people's homes, but the older generation, they weren't streaming exercise classes. If they weren't getting out and having coffee with their friends, if they weren't getting out to the symphony, if they weren't getting out to whatever activity that they genuinely enjoyed going to, their regular activities, again, back to if a generation that didn't grow up with formal exercise, physical activity was not a formalized thing as well. Or going and walking with friends. If you now could no longer walk with your friends because you had to stand 6 feet apart at least, well, okay, why bother? What's going to happen to your physical abilities? What's the increased likelihood of falling, which skyrocketed? What's going to happen to your ability to think? What's going to happen to your cognition? We saw that as well during the pandemic.
How connected it's going to deteriorate.
It's going to deteriorate. So how do we get to people? Again, it's whatever happens, but how do we create models and services that can get to people in different ways? And how do we give them different options so that people can make different options? And we don't have to just accept the only route is a facility. No. There's other options that we can go. We can empower people to remain in their house.
Why is it so common amongst the elderly to have vertigo issues?
Right. So vertigo is basically a symptom. It's basically a rotational spinning, but part of the problem is it becomes more common as people get older. And on top of the other complexities that they have, medications, dehydration, all of the other complexities that come with people as they go into their 80s and 90s, how do you tease out one type of vertigo versus another, one cause of dizziness versus another? The perception of it's just another older person experiencing dizziness. And what do we do about it? Knowing where to send those people, who's the correct specialist? Where do we send them? And the medical algorithm is basically, okay, primary care doctor to ear, nose, and throat doctor to neurologist. And that's about it. But that may not get them to where they want to be. So you send the person down a cascade of multiple medical tests and imaging. The doctors are trying to make sure that they're not missing a stroke or a tumor, and for good reason, because again, vertigo is just a symptom. It's rotational spinning. It can be caused by a brain tumor or a cardiac arrhythmia problem or all sorts of things. But the most common cause of vertigo is basically when some crystals in your inner ear balance system basically get loose and get into a place where they're not supposed to. So the treatment then is a simple repositioning maneuver on a bed or a therapy table or a massage table. And it's as simple as that. There's no medical procedure. There's not medication. There's not anything that's that complex. It's just the right specialist that addresses the right thing at the right time. And part of the problem in healthcare is it's become very much a checkbox system. And also we need everything to be quantified. The insurance companies, especially, they want to know what's the medical test that shows this, or what's the imaging, where's the lesion that shows this, right?
Basically the proof of X.
The proof of everything. Right. And what's gone by the wayside quite a bit is just the bedside exam. Putting your differential diagnosis, putting together all these different symptoms, the person's age, their gender, their symptoms. How did it start happening? What are they experiencing? What's made it better? What's made it worse? If you touch the pain, what does it feel like? How does the pain get recreated? Or how does the dizziness happen? How did it come on? All those basic things have now kind of gone by the wayside and gone towards the dependence of more and more medical testing and having to quantify everything. The problem with dizziness and vertigo is there isn't much medical testing
That's what I was gonna
to
ask.
help quantify it.
Yes.
It is more the bedside exam, and that means you just need the right specialist who really knows what they're doing to be able to figure out what's going on. It doesn't take that much. Well, that depends on what you call by a lot of time. Now it takes the treatment for repositioning for positional vertigo. Yeah, that can take some time, especially if it's an older person, because they're having to roll on a bed or a therapy table or a doctor's table. And that can take time, and they have to hold positions for a certain amount of minutes. So, you might be taking 45 minutes with an older person to treat them for positional vertigo. And so that can be a challenge as well if you're in an ear, nose, and throat doctor's office, right?
Yeah, they're right. What you're describing, is that the treatment, or would that be the diagnosis?
It's a combination of both. That's the other problem that we see. So what I'll oftentimes see, and of course, people come to us as the specialists because they've gone to other places, or they went to the quote unquote vestibular specialist. And often patterns that we see will be that they'll do the testing for positional vertigo, but then they'll perceive the testing to be the same as the treatment. So they'll test for it and then say, okay, you're good. And not realizing that wasn't the treatment, that was only the test. And these are the people that are being labeled as the vestibular specialist, right?
I don't understand how that's even possible.
Yep. So then people go to the quote unquote specialist at that big hospital system thinking that they went to the specialist and it didn't work. So now for another decade, they're having to suffer with the condition that now they are just accepting, not realizing that it can be as simple as just the right diagnosis done by the right specialist and then just given the right treatment.
It doesn't make sense. I mean, it makes sense. It doesn't sound like it should be tolerated, and you won't even know it that you may have become a victim of that scenario.
Right.
I'm assuming the reason you go 10 more years is because you've addressed it. You went and saw a specialist on this particular thing, and they said it wasn't that.
Right.
Next, but in fact it was that. They just never truly treated it.
Correct. And
I'm floored.
And positional vertigo is the most simple of vestibular disorders to evaluate and treat. That's not getting into all the other vestibular disorders that are far more complex than positional vertigo. Now, positional vertigo is not that simple. It can be simple, but sometimes it can get complex, but it's still, in my opinion, the most simple vestibular diagnosis. And so then you start getting into all the other things that cause dizziness and balance problems, and it can become very complex. It's about the right specialist to address the problem. So it's very common for people to see about 3 neurologists, 2 ear, nose, and throat doctors, a cardiologist, a pulmonologist, and who knows what other specialists. They're going to see the psychologist next before they come and see us. But if we're not going to work out, which they're kind of lost hope in, now they're going to the psychologist after they see us, because now they just think that they're crazy, because everybody else is beginning to think that they're crazy, because they have this dizziness problem that has basically put them out of commission, and they can't figure out why. And nobody has answers for them.
How many people do they have to go through before they get to you? How do they find you? And eventually you're able to like say, oh, yes, it's this thing that we're specialists at. We got this. We can figure this out for you. We can get this resolved.
Right. For something like positional vertigo, it's on average, it's about 6 healthcare providers.
Years.
And usually quite months and years. I've seen upwards of 25 specialists. That was 2 different patients back to back, 2 different weeks, 25 specialists until they got to us. And oftentimes they come to us through just happen to run into the correct healthcare provider who can refer to us, or of course, getting the word out. And that's the biggest thing that we're working on right now, is how do we get the word out to empower people to recognize that, wait a minute, this might be a situation that I can learn from, and I might be able to find the right place to be able to help me with this problem, or someone that I know. But the main thing is, the main thing to know is dizziness doesn't happen just because. Balance problems don't happen just because. There is always a reason behind it, or multiple reasons behind it. It's just a matter of finding the right specialist who can find what the reasons are and then develop the right solutions.
Incredible. I did this last time we were talking. My jaw was dropped because some of this stuff sounds insane to me. You would think that by now we would have a more common, protocols to pinpoint these things. Yeah, there's some doctors that are better than others, or specialists and whatnot, but you go to them because they're supposed to know their stuff, and instead you end up wasting years of your life,
right,
and losing your mind. These old individuals, these older citizens of our society, start thinking that they really are crazy because they cannot find the problem, the root cause of their dizziness or their vertigo.
And that's if they're lucky. So what's very common is they're just kind of written off as it's just another symptom that they have amongst all the other symptoms, and the healthcare providers don't know what to do about it. And they're a certain age, and this just comes with age, or maybe it's dehydration or whatever it might be. So if they're lucky, they'll be sent down the path of, let's find out why you're dizzy, or let's find out why you're experiencing vertigo. A lot of times we have great doctors that send people to us because they've become very attuned to, this might be something that you guys can help our clients with. What do you think about this person? And so then what might happen is they'll send someone to us while at the same time, or go ahead and order the MRI and CT and everything else. Make sure that it's not a brain tumor. Check those boxes. Make sure that it's not something life-threatening. And at the same time, the most likely problem is something that's far more simple and not life-threatening. Now, there are other times, and this is where we help out as well, we're contacting the doctor immediately right out the door, right after seeing the client, and basically saying, yeah, I don't see any indication of a vestibular problem. Mm-hmm. So it's a good thing that the person's getting the MRI as well. Yeah. So we can help tease that out. And a lot of the times, the doctors that we work with like to go to us for that reason. does this look like a vestibular problem? Or if the vestibular specialist is saying, no, this doesn't look like a vestibular problem, then we know how quickly we need to get them to, let's say, a neurologist, or how quickly we need to get them in for imaging, or whatever needs to be done. And that's really, I think, more the relationship that needs to happen in healthcare.
It's a good partnership.
It's a good partnership. It's get to your primary care provider, and then from there, it's getting the person to the correct specialist. What's the biggest challenge that you guys have been experiencing with your parents?
My biggest challenge with my parents is doing the exercises.
Yeah.
Like, he actually, my father, I think one week, my sister went out of town and I was in charge of therapy sessions. But do I have to be there? Of course you have to be there. Because I'm also the translator. I'm like, all right, I'll be there. But I noticed that he was great at trying to do the work and like pushing himself in ways that, like, the therapist, like, no, not so deep. The problem is doing the work after.
Right.
Got him the weights, got him anything and everything that he was trying to do. I was still all 100% on board. Whatever you need, Dad, let's go, let's get it. Check in on him, visit him. Like, have you been doing your work? I see the weights getting dusty over in the corner. I'm like, Dad, just walk.
Right.
Because in everything you're saying, 100% of the things I relate to, understand, or have visual pictures of what you're describing. The idea of him just getting from, like, now I think I need to call him. The idea of him getting from his bed to the restroom or to the kitchen, or get himself some water, get himself a little snack. That to me is empowering.
Right.
So you showing up at the door and actually helping assist with this is a fantastic idea, but them doing the work in between.
The other question is, why don't they want to do the work in between?
My guess is he just doesn't care to, because we talked about this before. He comes from a generation that didn't do anything.
We got to meet them where they are, right? And oftentimes, why aren't the exercises done? And yeah, it can be an energy problem. It can be a generational differences, and we see that all the time. So we're asking a generation of people who did not grow up with formal exercise to take a sheet of 20 exercises that are, cookie cutter in nature, and just run through these. And this is your exercise program. And if you don't do these enough and we can document that you have, then we're going to discharge you for non-compliance, and then we don't continue. And then we find this out, of course, when we go to the client's house, much later on, and then they take out this sheet of 20 exercises that the last physical therapist gave them, on top of the other sheet of 10 physical therapy exercises that they had when they were in skilled nursing. And then, of course, the sheet of, 10 more exercises that they had in the hospital, and all the, and again, it's very formalized, but what we really need is, what do they really want? They want to be able to be active and independent in their home. So for us, the exercises is more geared around, okay, how do we get you to walk in your home safely? If the goal is to have the integrity and everything else to get to the toilet, then that's what we're focusing on. We're not worried about, sitting in a chair and kicking our leg and strengthening our quads and all this stuff. It's not about the formal exercise. It's, what does the person want to do in their life, and how do we match the exercise to what they want to do in their life? Why should they exert the energy and the effort and the time as they see it to do all that if it's just to check the box, or because I told my kids I would, or to, so I won't get kicked out of physical therapy or whatever? Let's figure out what they really want and focus around that. So if it's being able to walk in their garden again, let's focus on that. How do we get there? If we want to get out of the house and into the car so that we can get out in the community, let's focus on that. How do we get there? And so then the rehab, and this is true of high quality rehab that we see all the time, even in the traditional system, oftentimes in, inpatient rehab, wherever else, some of the best places you'll go, it's that type of high quality care. And so it's bringing that to people's homes on a mobile service. And that's oftentimes what you don't get from home health, not because of the fault of the healthcare providers in home health. It's because their hands are so tied with red tape. And you can have those great healthcare providers that might work in home health, but are they going to last that long? Or are they going to get burned out? Or can they maintain that energy, that enthusiasm, and continue to, take all their documentation home, and that's all they do all weekend long, because that's the amount of red tape that they have? Because if they're actually going to spend the time with the patient, then how are they going to get everything else done that they need to do? So how can we provide a service that meets the person where they're at and focuses on what they want to get back to doing with themselves in their life, with their families, and in the way that we communicate with them, in the way that we provide the service to them, even how often do we see them? How many times a week? How long do we see them? A lot of our clients work with us for 2-3 years. That's not abnormal.
What you said you clicked. You made something click in my head. It's functional.
Yeah.
You're the purpose of what you're working, your actual exercises, because you're right. There were just a bunch of, curls or stepping on a slight step, range of motion type of thing. And I'm sure in his mind, there's no connection between that and what he needs to do day to day.
Right.
This has no purpose. This is no benefit.
Right.
So if there's no benefit to my daily life, why bother? Why should I do this? Screw it. Yeah, I did it, son. And then we know the truth.
It has to matter to them.
Yeah, it does. And this is just basic human behavior. If it doesn't matter to an individual, they're not going to be engaged and truly do the work.
Right. And it has to be the rehab professionals that know how to match whatever we're doing with the older person to what is meaningful in their life based on what they want to get back to doing in their life, and for us to communicate with them at that level and really find out what they want, not what the kids want. Yeah. Of course, we get that information as well, and it's valuable. And we do want to find that out. And a lot of times I like to ask separately or together, or I like to find out the information. I'll ask both. What do you want versus what do you want? That's important. And then we can figure that all out, because teasing out what the younger generation or the children want versus what their parents want is very important. And sometimes you can use a bit of both to come to something better, because their children might be shooting for the moon. I want you to get back to being able to go out to dinner with us like you used to. And their parent might be saying, yeah, I don't really want to do that anymore. I don't have desire. I just want to be able to get around my home safely and to live in my home. And that's all I want to be able to do, to stay in my house. And so then you can find something in between. Or do you get started somewhere and then build up? And sometimes what we'll often find is, of course, because as we work with our clients, they find that they are able to achieve things that they haven't done in 5 or 10 years. A word that they use oftentimes in rehab is prior level of function. Now, understand, I used to be a personal trainer as well. I never understood that concept of prior level of function, which means, okay, we can only focus on getting back to whatever the prior event was. Wherever you were before this last event was, that's what we're focused on. My thought was always, why are we stopping there? And I think that's the other reason for the mobile service, the way we've set it up, the way it's been set up, is how do we get you beyond just where you were before whatever brought you here? How do we get you back to the way you were 2, 3, 5, 10 years ago, if at all physically possible. And a lot of times we can. And that's the type of thing what we tend to see with our clients. They're able to get back to things that they haven't done in 5 or 10 years. Or if they can't, they know that they've given it the best possible shot. And as a result, they're able to be in their 90s or whatever age, and instead of declining, they're either slowly progressing or at least maintaining. They're doing a lot of work, but they're doing a lot of work that's meaningful to them because we're focused on the things that matter to them. And that's what motivates them to continue to do it over the long term. And then we tend to have clients that would be, one client I can think of directly came in for vertigo. Room was spinning. He'd been dizzy for the past 6 months. He'd been declining. He was not far away from going into a nursing home or the hospital. Treated the vertigo and started seeing him 2 to 3 times a week, worked on the strength and balance and everything else. And 3 years later, he's still going out and going on the boat to his lake house, going to coffee with friends, going to weddings, and to see his grandchildren get married.
Wow.
And things that he didn't think he'd be able. Yeah, he has his life back.
To think that they're at that position where the room is perpetually spinning.
Right.
That has to be debilitating, obviously.
And terrifying.
Like when you walk, I've never had that. So I'm assuming when you're walking, you essentially feel like you could fall at any moment on whatever.
That can be part of the problem, yeah.
To be in that situation and then to take them to where now they're actually participating in day-to-day family functions and part of the grandchildren's lives. It's good work. Thank you.
One example of a success is a 90-year-old basically who was told by her doctor that she would live to be 100. And her response was, "Oh no, I don't want that. If that's going to happen, I've got to take care of my body." So that's when she contacted us, right? And at the time, she was having a lot of back pain and a lot of balance problems and a lot of energy problems and everything else. And she was getting around her independent living facility with a motorized scooter. And she'd been doing that for several years up to that point and just, kind of accepted. But she understood the fundamental idea that if I'm going to live another 10 years, I've got to take care of my body. So people don't have to take care of me so that I can remain independent, so I can take care of myself. And I think that's what drives a lot of older people is I want to continue to take care of myself. I hear that from them. I don't want to be a burden to other people. I want to be able to take care of myself as much as possible. So she's, using a motorized scooter to get around. She could walk about 100 feet. So, kind of like a quick little jolt down the hall. And then she was done. Within about 3 months, and by the way, she had to walk herself up to stand up from a chair. So she had to kind of go from, this arm to this arm to this arm, and then even then could barely stand up from a chair. Within 3 months, she was walking all around her independent living facility, walking in the community, without a walker, standing up from not only a chair without her hands, but a low, soft couch 20 times without her hands.
Oh, really?
In 3 months. And this is someone who's 90 years old. And the reason she got there is because she works really hard, for one thing. And she stayed with the plan. She executed on it relentlessly. And we kept progressing and progressing. And I think that's the key, is the progress, right? It's being the coach of that progress that specializes in working with that person. And because of that, she was able to empower herself to be able to walk not only in the independent living facility, which if you've ever been in those places, those are long hallways and there's a lot of walking that goes on. So she's able to walk without a walker and also out in the community so she can go to the places that she wanted to go. And she was able to just retire the scooter in the corner.
It's got to be so fulfilling.
Absolutely. And as a provider, of course, you get to be a part of that. I mean, that's very, very
your
rewarding.
Engine's running as well.
Oh, our engines are running every day because it's those great people that we work with. And that's every day that I'm so grateful that myself and my team, we get to work with people like that every single day. And we're so grateful to be able to do that. And that's the fun part about it. So another good example is a 70-year-old client of ours. She came in when she was 70. And her biggest problem was, of course, dizziness and vertigo. And to the point where she was also having fogginess and cloudiness. And her biggest concern was that she was getting Alzheimer's disease as well, because now it affected her thinking. Now, with positional vertigo, it's important to understand it can cause a whole host of symptoms that don't appear to be related to the vertigo, but it can cause all sorts of crazy symptoms. So it can really mess with people's minds. And so she came to us, and what we were able to do was, within a few treatments, of course, address the vertigo. And once the vertigo was gone, her dizziness was gone. Her thinking was completely clear-headed again. And so now she was able to realize that I don't have Alzheimer's disease.
That's got to be a relief.
A huge relief. And so she's able to then run her business on her terms, do all the things that she'd been doing all along until she started experiencing those problems. She came into us from a newspaper ad. And just hearing about what we do and just getting some basic information from us. And then we're able to reach out to her and say, what's going on? And through that, we're able to find a solution from someone who's been suffering from a number of months, not only with vertigo, but she thinks she's also getting Alzheimer's disease as well. And it's like, I didn't think I was getting older, but apparently I am, right? And it's like, no, that's not the problem. It's not your age. You have this condition that just was causing everything else. And, she went to her doctor and everything else. And she had another vestibular disorder that was more benign, but there was the question of, okay, so is that causing part of the problem? And so then it's sifting those things out. And that's where the specialty comes in, because these things can become complex. There is a medical history to the whole person. There can be another vestibular diagnosis involved. And so we got to tease all these things out. And when those things happen, it's step by step, solve what we know is there. And then once we solve those things, then what's underneath, we find out what's really going on. I think that's what we see more than anything else. Another situation, and by the way, she's, exercising now and, just doing, great things and, just running a business and just, enjoying life. Another situation was a person who was diagnosed with a certain vestibular diagnosis 30 years ago. And it's a diagnosis that is, it's not curable. It can be managed. So Meniere's disease, it can be managed, but it's not curable. Now this person goes on for another 30 years thinking that they have Meniere's disease, told by 2 neurologists that they have Meniere's disease. And of course, then they believe that for the longest time. So they have dizziness and balance problems. They're on medications and everything else. And they're having to live this way for a very, very long time with this diagnosis attached to them with no other solution. And the crazy part was they came in to us, they came to us for another reason. And it wasn't until I started asking about the balance problem. Do you have any balance problems as well? Oh, my balance is horrible. Well, why is your balance horrible? Well, I was diagnosed with Meniere's disease 30 years ago. And then it starts this conversation of, well, but nothing can be done about it and all that, because that's what they've been led to believe. Yeah. And these are very educated people, and this is what they're being told and led to believe. And we start going down the path and come to find out, she had positional vertigo, so she had a very treatable condition. And the way I explained this to her was, like, this is something that is a part of the or separate from the Meniere's disease, but how much of this is the Meniere's disease versus how much of this is the positional vertigo. You could have had both all this time, or you could have just developed the positional vertigo later on, or it could have gone on and off. Either way, we can treat it now. So here's the really fun part. It doesn't stop there.
Please tell me.
So then she goes to an ear, nose, and throat doctor, who then realizes that, wait a minute, you don't have this symptom, or this symptom. And now you're a whole lot better after being treated for positional vertigo as well. And basically tells her, you don't have Meniere's disease.
Ooh. Wow.
And of course, as a physical therapist, I can't make that diagnosis. That's up for the neurologist or the ear, nose, and throat doctor or the primary care doctor. That's up to them to make those sorts of diagnoses. All we do is basically we can address the vestibular impairments and the vestibular diagnoses as far as positional vertigo. But once we got that information, it was, okay, now what's possible?
Right.
So for one thing, Meniere's disease is a completely manageable condition, much more than what people think. And oftentimes what they're experiencing is not the Meniere's disease, but they might have positional vertigo on top of that, because when one person has a vestibular diagnosis, when there's something wrong with your main central balance system, oftentimes there will be other things that are wrong with their main central balance system. People will often have multiple diagnoses on top of each other. And so it's not just one. So the mistake oftentimes in healthcare is they're labeled as having a certain diagnosis when really, no, they have multiple diagnoses, which one is causing which. And then they might have Meniere's disease, but you can get them to the point where they're virtually symptom-free.
And they can manage it, like you said,
on a regular basis, or they have minor symptoms on a regular basis that you give them exercises for, and it gets better over time, and sometimes very quickly. And all that they might have are occasional flare-ups.
Wow.
Coming from being more or less debilitated on a regular basis. Having to think about a cane or a walker, or how am I going to manage through the day given how I'm feeling. And again, it's just finding the right specialist for the right person at the right time, and in a way that serves them and meets them where they're at.
Hello, everybody. This is TV again, the producer of the podcast. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove Podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thank you for listening, and we'll catch you in the next episode.